Guys, let's see about Parkinsonism today. Parkinsonism is a clinical syndrome characterized primarily by bradykinesia, which can be associated with increased tone-like rigidity, tremor, and loss of postural reflexes. The most common cause is idiopathic Parkinson's disease. We can also have atypical Parkinson syndromes like multiple system atrophy, progressive supranuclear palsy, Wilson's disease, manganese toxicity, antipsychotics, methylphenyl tetrahydropyridine, anoxic brain injury, which can also cause Parkinsonism. Genetic defect like a PARK1 gene mutation which produces alpha-synuclein. PARK2 gene mutation producing Parkin can also cause Parkinsonism. The main pathology is depletion of the nitrostriatal dopaminergic neurons and intracytoplasmic accumulation of alpha-synuclein, which is the Lewy bodies. Clinical features: REM sleep disorders, ANS symptoms, and depression are found many years before the onset of motor symptoms. Motor symptoms usually begin asymmetrically. Initially, the patient develops bradykinesia, which presents as micrographia and reduced arm swing. Then he can have a resting tremors, which is pill rolling movement kind of movement in the hands. Then he can have movements in the legs, jaw, and chin, but head is usually not involved. Rigidity, which is presented as a stooped posture, and cogwheel type of rigidity can be seen when the rigidity is superimposed with tremors. Lead type rigidity can also be seen. Festinant gait is rapid short stride length of steps, which is reducing. And mask-like faces, impaired balance on turning is seen. Soft indistinct speech is found in the later stages. Impaired postural reflex and also impaired cognition is seen in the late feature. Treatment, symptomatic treatment is given, no curative treatment. Levodopa, it is a precursor of dopamine. So since we know levodopa has increased peripheral metabolism, we give it with carbidopa, which is a dopa decarboxylase. L-dopa and carbidopa is given in the ratio of 4:1. It is so effective in Parkinson's disease such that if the rigidity and rigidity and the akinesia doesn't improve with levodopa, we should consider an alternate diagnosis. It is levodopa is non-responsive for symptoms like fall, postural instability, and dysarthria. Over the course of the treatment, the patient can have atypical findings like a wearing off effect, where we should place the drug without much gap. On and off effect is due to the drug levodopa induced dyskinesia, which can be treated with amantadine, dopamine agonist, monoamine oxidase inhibitor, catechol-O-methyl transferase inhibitor, and central anticholinergic drugs can be used.